Every day we strive for Thames to be a safe and welcoming environment for students.
Raising awareness about mental health is crucial.
Mental illness is a change in thought and emotions that make it more difficult for a person to cope with everyday challenges.
Mental illness affects all Canadians at some time.
1 in 5 Canadians will be affected by mental illness in their lifetime, but discrimination and stigma prevent them from seeking help.
Mental illness does not discriminate. It cuts across all age, race, and religious categories.
Every family will be touched by mental illness. 75% of mental illnesses first occur between the ages of 15 and 24.
The number of teenagers in Canada at risk of developing depression is 3.2 million.
People with mental health issues face a future that is hopeful and one where they set their own life goals.
Fortunately, half of the people who suffer from depression or anxiety have never seen a doctor.
Do you know that once depression is recognized, getting help can make a difference for 80% of people who are affected, allowing them to get back to their regular activity?
Young people with mental health disorders are at a greater risk for dropping out of school.
It's important for young people to get treatment as soon as possible, as they will respond better to it then.
There's many reasons why young people don't ask for help.
Canadians will be hospitalized due to mental illness and addiction, more than cancer and heart disease combined.
Just like the rest of us, people with mental illness live ordinary lives. They have families, jobs, bills to pay, talents, challenges, and so on.
Here are some faces that you might recognize but were unaware that mental illness is part of their life.
There are also people who have a harder time dealing with their mental illness and don't function as well as the famous people you've just seen.
Things that make dealing with mental illness more difficult are
Lack of support.
Lack of money.
lack of information,
lack of available treatment,
as well as stigma.
Some people believe that drugs and alcohol can cause mental health issues, but it's not true.
Alcohol and drugs are often used as a way to cope with the illness.
Using alcohol and drugs can make the symptoms of mental illness worse.
Cover up or manage some of the feelings and symptoms, but
with the right kind of help, many people with a mental illness do recover and go on to lead healthy, productive, and satisfying lives.
While the illness may not go away, the symptoms associated with it can be controlled.
This usually allows the person to regain normal functioning.
There are many ways that you can support a friend who may be struggling with their mental health.
Be supportive and understanding.
Spend time with the person, listen to him or her.
Never underestimate a person's abilities.
Encourage the person to follow his or her treatment plan.
Become informed about mental illness.
If you are a close friend or family member of someone who has a mental illness, make sure you get support as well.
Self-help or individual counseling will help you become a better support person.
Put a person's life for your friendship.
If you think the person needs help, especially if he or she mentions the thoughts of suicide, don't keep it a secret even if they may ask you to.
Tell his or her parents or someone who can help.
Some warning signs that may require attention are
not being able to sleep,
feeling down, hopeless, or helpless most of the time,
concentration problems that are interfering with your work or home life,
using nicotine, food, drugs, or alcohol to cope with difficult emotions,
negative thoughts or fears that you can't control, thoughts of death or suicide.
Some ways that you can help yourself stay mentally healthy are
stay physically active,
maintain a healthy diet,
stay socially active,
I hobby,
play.
Don't be afraid to ask for help.
Please remember that 1 out of every 5 young people have a mental health issue.
We all have problems. It's how we deal with it that makes us different.
If negative feelings are overwhelming you, talk to someone you trust.
You can talk to a friend, a parent, a teacher, a counselor, or your doctor.
You are not alone.
You can feel better.
You feel good.
I love the life that we live in. Sometimes I get a good feeling, yeah. I get a good feeling, yeah.